All right, the next presenter is JC with Cloud9. We're ready for you.
Yeah, do I get to click? Yes. All right. Hey, everyone. Yeah, great. I'm JC Adams, founder and CEO of this company called Cloud9. We are innovating in the mental health space. And the reason is because this is a long neglected segment of healthcare. It would be, and also we don't talk about it much in Western culture. If I were to ask for a show of hands in the bar as to who's seeing a therapist right now or taking psychiatric meds, that'd be kind of awkward. So in this day and age, we keep that to ourselves because of stigma. However, with numbers like this, 1 in 4, it's hard to ignore the prevalence of this in our society. And it's getting worse, and you're going to see much more about this in the public discussion. So financially, we spend about $150 billion each year on mental health care. However, the comorbidity cost of chronic physical illnesses that are tied to mental illnesses cost us $420 billion each year. And a recent Beacon Health Strategies report shows that you can decrease a population's overall health plan cost by up to 36% simply by integrating a mental health treatment program. So why is this? The fundamental answer is that the mind and the body are connected and guess what? Mutually dependent upon one another for overall health. So stress can lead to heart disease, anxiety, asthma, Alzheimer's. Depression can lead to chronic fatigue, obesity, diabetes, and so on. So it's amazing how modern healthcare has missed this connection for so long. And then finally, the market's changing so that the patient is now at the center of this collaborative care model. And what's happening is mental health is emerging as this critical component to reducing overall costs and improving patient health throughout populations. So there's also a void of technology. This industry's neglected technologically. There are not a lot of solutions out there. So we've developed the Cloud9 mental health app. And this is primarily an enterprise solution for hospitals and providers, but absolutely the patients use it, as you can see in these screenshots. And design is one of our core principles. In order to get through that stigma I talked about earlier, we need to make sure it's attractive, easy to use, and whenever possible, fun. To highlight our components, we start with the ability to intake and assess the patient. And in mental health care, believe it or not, this is still done with pencil and paper in a waiting room. So we do this digitally, it's mobile, it's gamified, and you do not have to have an appointment to check yourself in. And then we need routing and oversight to efficiently connect patients to the right provider that fits their needs. And then if they want to meet with that provider, not in person, they can use our app to have a video session remotely on the device from the comfort and privacy of their own couch. And what's really interesting about our platform is also our behavior data. This is like quantified self. The patient or just a consumer can track their emotional and mental states over time and through the device or getting data from wearable sensors like my smartwatch here. And then we need data analytics to make this information both meaningful and actionable for the patient and provider. And then we need enterprise integration. This has to be a turnkey solution for hospitals. We need to integrate with the leading EMRs, e-prescribe systems, and hospital systems, and our team has done this. So, whoops. The customers for us are hospitals, the providers, as I mentioned, but also direct to employers, and as well as the employers' insurance groups later on. And then secondarily, we can market direct to the consumer, especially with our consumer-facing features like the quantified self tool, later on in our strategically staged rollout and marketing plan. And there's a massive wave of demand coming in. We need automated services like the quantified self feature. Mental health is this perfect storm market. Telemedicine is exploding, and mental health is low-tech opportunity. But the regulatory drivers are fascinating in that the Mental Health Parity Act, combined with the Affordable Care Act, is one of the biggest moves in healthcare. 62 million new patients are going to have access to mental health coverage. Where are they going to go? Cloud9 has the best solution. We're ready to go. Version 1 of our platform is complete and being tested with providers here in Texas. And we're also going to be announcing our first hospital client soon. This turns out to be a very large healthcare system with very handsome licensing fees for a young company like Cloud9. We're very proud. So we're raising a $1 million seed round to finish out the product and also apply some of that to sales, general, and administrative. So, ladies and gentlemen, what we have is the right product at the right time. We have an all-star team with tremendous healthcare experience. They've done this before. And I can answer any of your questions afterward, but my question for you is, what can we do together to bring peace of mind to the world? Thank you.
Thank you, JC.
It's a good job. I'll be a little bit not as positive as I was last time. Think of them as positive feedback. One is, it took you a long time spend a lot of time just talking about the market. You're trying to educate the customer or the audience. And if you have to spend that much time telling the audience what the value is, it takes away time from actually discussing what is the value prop. So just think about, how do you quickly engage them and then talk about what you're doing. It seems like a little bit of a services play. I don't know if it's a product idea or it's a services idea. It's a great service idea. Go to a hospital, have them a way to engage their clients with them, and integrate in the back end with all the record systems and all that. So it seems like a little bit of a services idea. So have you actually found a customer or a hospital who's going to buy this from you?
Yes.
So that's where you may want to spend a little bit more time on, get a few wins under your belt. They're going to pay for this. I mean, this is a great solution for them to be able to engage their patients with them. Right now, there is no way to do that. I'm in services business myself, and we just built a very nice mobile app for MD Anderson for a different system. So I know those guys are money, and that's where you need to focus on. I would have liked you to spend a little bit time on the team, on the number of hospitals you could sell to. It doesn't matter how many mental health patients are there. What you have to tell us is how many hospitals you can sell it to, what's the price point each hospital is willing to pay, and how this is a $1 billion opportunity. And spend a little bit less time on the other stuff, the size of the market, the number of patients and Medicare and all that. Your customer, it seems, might be the hospital, and they have money. And if you say, look, we have 20,000 hospitals, and each hospital can pay $10,000, now we're talking some value here. But good job, it's a great idea.
One question I had was, when I heard enterprise, I'll be honest, I got a little shaky in the knees. For seed capital, it's a big solution. Inevitably, what we've seen happen on the venture front for the last 7-8 years is when we have a company at the Series A stage or even B sometimes going purely for enterprise, inevitably they build an incredibly customized product that doesn't scale to other hospitals in this case. We have one company called Clinician, which does exactly this, but for physical therapists. Gone on to raise about $20 million to date. And it took about 6 years to realize that enterprise wasn't the best route to go off the bat, and a lot of money. So anyway, every case is unique. I'm not saying that's not possible, but I do get, as an investor, definitely get a little leery when I see enterprise as a target. So I'm sure that's not your primary and only focus, but I did want to hear, what are your thoughts around the market opportunity? How many current customers do you guys have right now? And I'm not talking about consumers, but talking about potentially paying customers on the hospital or clinic side.
Yes, the addressable market, there are about 150 or so health systems the size of MD Anderson. That's going to be our first client, is a health system that size. We started with a pilot program of 30, yes, thanks. We started with a pilot program of 35 providers here in Texas. And our first approach was to go after the providers and digitally market to the individual therapists and counselors. And we decided to focus first on our enterprise strategy to lock down these key healthcare institutions before we start to market to patients and providers. And consumers would need to come later, as there's going to be a real shortage of mental health care providers. There's roughly 500,000 in the U.S. and 62 million new patients on their way. So we're going to need these automated services, and those are the components that we would use towards our consumer model later on, the automated.
Well, I guess just a quick follow-up on that is, with our company Clinician, for example, we saw the sales cycle in enterprise was exceptionally long, 12 months plus. Physical therapist. Anyway, I guess the one direction I would push you, I'd love the messaging. I guess the one direction I would push on, and happy to circle post-game on this, but their sweet spot was inevitably closing practices with 5 to 25 practitioners. And the good thing, once they figured out the model, all they had to do was sell. But it was crystal clear, their roadmap. All they had to do was go sell. The product, worked and did what it was marketed to do. But they had to pursue and close clients of that scale before they could go. They didn't want to go downstream to single players, single practitioners, nor upstream due to the customized nature of the service rendering. So anyway, that would definitely be a sweet spot where I've seen be effective in a similar healthcare space. So.
Great feedback.
So one of the biggest differences between socialized medicine, like if you go to Canada or Europe and the United States where clinicians bill for their services, is that taking an approach for any medical device or any type of healthcare provider, when you take the approach in the United States that, hey, we're going to save you money, that's kind of a nebulous figure for them. They want to know how you're going to help them drive revenues. How are they going to be able to bill for services provided? Because saving money, you tell that to a doctor or provider and they're like, I mean, they're not responsible for that, but what they are responsible for is billing codes, right? In Europe, they don't bill anything, it's all cost. And so if you can tell them, hey, I'm going to save you all this cost, now they'll talk to you instead of, hey, we're going to drive revenue, because they don't bill like we do here. So if you're selling in the United States, you need to show a clinician and you need to make people believe that you can make their process more efficient and help them bill for their services. If you make this so easy they're unable to bill for their services, they're not going to use it. And a lot of people fall into that trap and they're like, well, we're going to make this so easy for you, you don't even have to see your patient. And they're like, well, that's how I bill and that's how I get paid. And so, so you're actually making it too efficient where they're going to lose money. And so you have to figure out a way to show them, hey, this is a more efficient way you're going to be able to engage more patients, you're going to be able to bill this much more, drive revenues for them, so that there's a more efficient use of their time, but they're still doing what they do, which is bill on codes, et cetera. And so the only other thing is just the 62 million potential people with the Affordable Care Act. I don't know the uncertainty or the future of that or what, just politically. But again, if at every provider you can show, hey, I'm going to help you drive revenues and help you engage more customers, et cetera, just saying, well, this will cure all sorts of other problems, other physical ailments that aren't your problem, then just trust me, that's a little bit harder for them to bite up. Do you know what I mean?
Absolutely.
Okay.
You're absolutely right. All right, wait, yes.
How are you working with HIPAA and the FDA?
We're fully HIPAA compliant, fully IT compliant, not FDA regulated. Not in our space. Yes.
How do you think this will help to increase the number of people that wouldn't have pursued mental health, pursued a therapist? Mm-hmm. How do you think this will help adoption?
Tremendously. For people who don't want to, if you're in a small town in East Texas, there's no therapist, first off, that's in rural areas in America. They're in the urban centers. So first off, to make this app available to those people is groundbreaking. For people who don't want to actually darken the door of a psychiatrist's office, to have someone say, hey, there's this app you can download and you can intake, assess yourself, you can track your behaviors on your own just for self-awareness, You don't have to see a psychiatrist, but if you want to, with a touch of a button, you can, from the comfort and privacy of your own couch. I think we've got something that can change a lot of people's lives and make it more accessible and hopefully more affordable. And yes, we do need to talk about the revenues too. I agree with you 100%, and we have addressed that, by the way.